Hi, everybody. Captain Anderson and Dr. Frank here. We're just going to take a few minutes of your time and discuss a new, really important and exciting tool that we're going to be rolling out. We're going to have the ability to transmit 12 and 15 leads, not only to the resource hospitals, but to the medical director, and in the future, probably to the EMS captains. Initially, we're going to be able to transmit to 5 of our resource hospitals: Sarasota Memorial Main Campus, Sarasota Memorial Venice, Inglewood, Fawcett, Bayfront Health Port Charlotte, and then, as I said, you'll be able to transmit directly to Dr. Frank, and then in the near future, probably the EMS captains. So, Dr. Frank, why is this important, and is this going to change the way that we do business? Is this going to change our way that we do patient care? And then how exactly is this going to look as far as the crews transmitting these EKGs to the hospitals and to
Sure. Thanks for introducing that. So yeah, we're really excited to be able to transmit these EKGs. We know that our overcall rate for STEMI is about 30%, and the hospitals have been activating the cath lab, at least Sarasota Memorial Hospital Main campus has been activating the cath lab based on our call. Mm-hmm. But there are times, where we have false positives, and the cath lab gets activated, and there's resources that are, overutilized that we could sort of fine tune. So our goal is to utilize our resources as best as we can, and by transmitting our EKGs, we can do that. So you're going to recognize ST elevation MI and transmit it to the hospital. And sort of to answer your question, how is this going to change what we're doing? It's just adding one step, and that's transmission of the EKG. So what you're going to do is, we're still going to be meeting our benchmarks, our goals of times, less than 10 minutes to acquire a 12 lead for patients with suspected acute coronary syndrome. And as soon as you identify the STEMI, you're going to transmit it as soon as you can. So if you're in a house that the Wi-Fi isn't connected to the rescue and you're not able to transmit, you'll transmit it as soon as you can get back to the rescue. If you're close enough to the rescue that you can identify that you can transmit, then you transmit then. So really the goal is to transmit as soon as you can, because what that does is sends the EKG to the resource hospital. The resource hospital gets it, prints it out, gives it to an emergency physician, and we will either say that it's a STEMI, we agree that it's a STEMI and activate the cath lab then, or we will not activate the cath lab. So time really matters. The sooner the better. There's not going to be two-way communication though. So if you identify a STEMI and you transmit it, it doesn't matter what the hospital says. You're going to treat it as though it's a STEMI. Okay, so I don't see that changing in the future, or at least in the near future. But if you identify a STEMI, you transmit it, that's a STEMI, in terms of the pre-hospital care.
Is there going to be a policy change, protocol change?
The only protocol change is that we're adding that you transmit the EKG to the resource hospital. And like I said, the resource hospital will get the EKG printed out, and the physician will see it. It's important that we make sure that we don't delay scene time. And that we remember to transmit these each time.
And then how about if there's a question in the field about recognition of something in treatment? I had mentioned that they're going to be able to transmit it to you.
Yeah, so that's another leg of this. So the first leg of it is STEMI, and all of those will go to the hospital. And the second leg of it is if you have a dysrhythmia that you have a question about. So let's say you can't tell something's VTAC versus SVT with aberrancy, or you have a question, a clinical question. You can activate the online medical command system, call the captain, and then in our discussion, you can transmit the EKG. I'll get an email with a PDF of the EKG, and it's a really crisp, nice EKG. Mm-hmm. It's great. And then I can look at the EKG, and the captains can look at the EKG, and we can have a clinical discussion and make a decision together.
Awesome.
Okay, but it's important to know that that's not for STEMIs. And it's ideally not for, whether you want to ask me if I think it's a STEMI. We're still relying on you to say, this is a STEMI or this is not a STEMI. Mm-hmm. The idea is not to say, let me transmit this for online medical command to determine whether it's a STEMI. You have to make that decision, but it's for the transmission to me is to talk about, dysrhythmias and other things like that.
Right. All right. Anything else, Doc?
No, I don't think so. I'm really excited about this. We've been working on this for going on 2 years.
Yeah.
So it's and Captain Anderson's spearheaded this and done a great job. So thanks very much.
All right. Thank you, Dr. Frank. All right. That's all we got for today. If you have any questions or anything, feel free to contact your EMS captain, and we'll see you out there. Thank you. All right, so our chest pain patient is positive for a STEMI. So we're going to let dispatch know that this is going to be a STEMI alert, and obviously what hospital we're going to be going to. So for this case, we're going to call a STEMI alert to SMH Main. We're going to call them on the med radio, and we're going to let them know that we're going to be transmitting the STEMI 12 lead to their facility. This is very much the same as it is when you transmit to ImageTrend. So we're just going to hit transmit, and then you're going to see report. We're going to change that to all from code summary, and then the site is obviously in this case is going to be SMH Main. As I had said in the earlier video, there are 5 different resource hospitals at this time that we can transport to: SMH Main, SMH Venice, Inglewood, Fawcett, Bayfront Healthport Charlotte, and then the medical director. So we've selected SMH Main, and then we're just going to go back up and hit send. Then you're going to see it's going to give you the percentage sent. This one's going to go pretty quickly because there was only 2 12 leads on this one. It might take a little bit longer if there's multiple 12 leads, 15 leads, etc. You can see this one went pretty quick. Transmission's completed. You hear the little beeping, tells you that it's completed, and it should be sent, and that's all there is to it.